All right, I think you're good to go.
Okay, thank you, Colton. Hello, I am Carol Bragdon and serve as the chair of the APRN Committee of the Kansas State Board of Nursing. I ask the members of the APRN Committee to respond to a roll call signifying their presence at this open meeting that is being held by Zoom and YouTube. Patsy Zeller.
Present.
Jade Ramsdell.
Present.
Andrea Watson.
Present.
Jamie Harrington. Haven't seen Jamie yet. Dawn Gosnell.
Present.
Benjamin Cochran.
Present.
Jennifer Bendur.
Present.
And Bobby Mansfield.
Present.
I ask also the following board members signify their attendance. Carol Moreland.
Present.
And Jill Simon, Executive Assistant.
Present.
Public comment allows individuals to address the APRN committee about their concerns, but the Kansas Open Meeting Act, or COMA, does not require the APRN committee to provide public comment or answer questions from individuals. As we would not know what comments an individual may make, we would want to provide public notice to the public of our intent to discuss a particular matter so that the public may listen and observe our discussion. Public comment will not be taken today due to that concern, and because this meeting is conducted by conference call, where the connection may be lost over time and the period for the meeting may not allow everyone who is present to comment. Because we're conducting this public meeting remotely by Zoom and YouTube, I state for the record the following information. On November 23rd, 2020, the board sent notice of the meeting for the APRN committee to all individuals who have requested notice of the committee's meetings. Additionally, the notice and agenda were posted on the board's website, ksbn.kansas.gov. You may obtain a copy of the notice and the agenda at that website or by sending an email to carol.moreland@ks.gov with the subject line request for the agenda, and the board staff will send it to you. The notice also advises individuals to contact the board's office at 785-296-2967 if they experience technical difficulties during the meeting. Number 2, the notice contains the link and password for Zoom and the link for YouTube that allow the public to attend this meeting free of charge. The notice also advises individuals to contact the board's office at 785-296-2967 if an individual experiences technical difficulties during the meeting. The state of disaster emergency due to the COVID-19 pandemic, as declared by Governor Kelly and extended by the State Finance Council, will expire December 15th, 2020. Because the requirements of COMA are not suspended, we will be conducting this meeting pursuant to the COMA and KR 16-20-1 concerning compliance with the COMA during an emergency declaration. 4, the connections to Zoom and YouTube are the only mediums for interactive communication offered during this meeting. 5, each member of the committee, board staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. 6, each participant to this meeting shall ensure microphones, phones, or other electronic devices are on mute when the participant is not speaking. Each motion will be clearly stated before the committee votes, and the chair will announce the results of the final vote. And 8, a statement or motion will clearly identify and authorize by delegation each member of the committee or staff who will be permitted to sign any document on behalf of the board. 9, the meeting is being recorded and the recording will be posted to the board's website. The committee has the following listed items on the agenda: call to order, review of on-site packet, additions or revisions to the agenda, announcements, approval of minutes for the meeting held September 2020, unfinished business, new business, agenda for the committee meeting March 2021, and adjournment. The meeting is now called to order, and the committee will now consider the next item on its agenda. Okay, we do have an on-site packet pertaining to KSA 65-6182 Board of Pharmacy monitoring program proposed legislation. Revisions to the agenda. I would like to add the KSA 65-1682 to the business under unfinished business prescription monitoring program. Any other suggestions, additions, revisions to the agenda? Hearing none, we'll accept the agenda as published with that one on-site addition. Announcements. I don't have any. Carol, do you have any announcements?
The only one might be if you want to welcome Jade and Andrea, the new board members that are on the committee.
Absolutely. Jade and Andrea, welcome. You've chosen a wonderful committee to join, and we welcome your participation greatly. Thank you. Okay, minutes of September 15th, you should find published in your packets. Mine are on page 3. Any questions or comments, corrections seen in those minutes? Hearing none, do we have a motion to approve the minutes of September 15th?
Madam Chair, is there a member of the committee who would like to make the motion that I move to approve the minutes from the September 15, 2020 APRN Committee meeting as written?
I would entertain a maker and a second to that motion.
Motion.
And I'll motion to approve.
Okay, did you get that, Jill?
I got, Jennifer, was she the second, and then Ben was the first?
Is that okay with everybody?
Yeah, that's fine.
Fine with
All
me.
right, we're good then.
Okay.
Thank you. We'll have Jill, I guess I should have mentioned, we'll have Jill read the motions. It seems to go a little smoother if we have her than one of us trying to generate them. So thank you, Jill. We appreciate that. And do give me the high sign if I forget that we have to have a motion on something. So
Okay.
we appreciate that much. Okay. Unfinished business. We'll move on to the Prescription Monitoring Program Committee report. Bobby?
Well, hi, everyone. There was a KTRAC's Prescription Monitoring Advisory Board meeting last Friday, December 4th. I had a conflict with my Washburn responsibilities, wasn't able to attend, but the meeting was an abbreviated, usually a 3-hour meeting, and it was only a 1-hour meeting. And it looks like as I reviewed the agenda, it was going to be peer review of cases that have risen to the top in data patterns in KTRAC. So usually that's an individual, a prescriber, or a pharmacy that meets criteria for a closer view by the advisory board. So I did not participate in that. The meeting prior to that was on October the 16th. I was party to that meeting. During that peer case review, I know there was one case that involved an advanced practice RN, and that was referred for review to this board. I'm happy to say in the 4+ years that I've been a member of the board, that happens very infrequently. The other content of that meeting, KTRACS is looking at ways to improve usability, improve participation by prescribers. So they had some improvements they were making. Barriers for some people had been if The K-TRAX is not integrated into the electronic medical record, meaning that you have to go outside of your EMR and independently access the K-TRAX link, which takes longer, requires your password to be different. Those people were having trouble with a password reset every 90 days. Kind of annoying to have to change. I understood why, but it was decided that that password could be reset every 180 days to improve usability. And also there is interest for those agencies that have integration ability with K-TRAX to be able to access the prescription monitoring system of surrounding states. And that's particularly important if you're a border clinic. So it is moving forward for that to happen with Oklahoma, Colorado, and interestingly enough, Missouri is not a single prescription monitoring program state, but St. Louis County is. So Missouri is a bit of a patchwork for getting information about use of controlled substances by prescribers, patients, or dispensing by pharmacy. So that's kind of what's happened in the last 3 months for the K-TRAC Advisory Committee. I appreciate again the opportunity to serve and represent the Board of Nursing. In my comments was reference to the draft 2021 legislation, and I see that you've added that as an agenda item, so I'll just defer for that larger conversation.
Thank you, Bobby. It sounds like we're making good progress on integrating that. I'm very pleased to hear those things, and thank you for your good work.
Hey, and I had my webcam shielded during all of that. You didn't even see my facial expressions.
Now we do. Yes, thank you very much, Bobby. Carol, do you want to introduce the information regarding the legislation 65-1682, and then Bobby, do feel free to add comments or anything else you might want to share with us.
Sure. This is Carol Moreland, Executive Administrator. And I apologize, this was not in your packet, but truly I got this from Alexandria like the day after the packets were done. So that's why it's in the on-site. But she wanted to get it to us because she does want some feedback. So I did explain, because they're getting ready to send this to the reviser. And so I explained that we wouldn't be having a meeting until today and then the board meeting tomorrow, but that I would get feedback to her. Most of what you see here is what they took over this year, 2020, to the legislature. And of course, really nothing got acted on healthcare in that session. So they're going to try again in 2021. And when you look through this, if you go to page 3, you'll see a red section. The stuff that's in red is new stuff that they're adding for 21 that was not there in 2020. And she kind of just gave me a couple of bullets here to cover with you. The first one being discretion for the board and advisory committee to adopt regulations, creating a fee for service option for the integration program if and when grant funds terminate. The current anticipated end date is September 2022 if no additional grant funds are received. And then the second bullet is at the request of several hospitals, an option to allow aggregate utilization data to be provided to hospitals/health systems on user utilization and prescribing trends. Those are the biggest changes that you would find in red from what they took over last year. So I don't know if Bobby has anything else to add to that.
I think, Carol, I want to just back up because I have not had time to see, and this is the first I've heard about those tweaks for 2021. I had a couple of comments about the 2020 content, which was in section 65-1689 in what I saw on the Board of Pharmacy website. And you know, I know before you wanted me to look into that annual maintenance fee that the Board of Nursing is asked to shoulder without any real clarity about how that proportionality is established with all of the stakeholders. What's interesting to me is that I have worked to get the language used in the committee changed from physician to prescriber. And finally, when there was some data about how many advanced practice nurses also prescribe, that change happened, but it was not a 50-50 ratio, I can tell you that. So I just wanted to report back to you that I've not really been able to have that conversation, and that may be a moot point if they're talking about doing a fee-for-service structure in the future. I don't know how that fits in with what the professional boards have had to contribute. But the other thing in the previous legislation that was a battle for me that I lost was that there is a section that says that, see, right now we are not in the statute for having an advanced practice provider on the advisory board. We are there by invitation. So the new legislation or changes offers the option to codify that. But the way that it's written is that it can be a provider nominated by either the Board of Nursing or the Board of Healing Arts for a 3-year term. So it can be a PA or it can be an advanced practice nurse. So I just want to tell you I'm not happy with that clause, and I see that it's still in the 2021. Now, from our perspective and the role that I've had in the advisory board, I know that they respect the voice that they've heard. I have actually lobbied, and it's kicking me kind of in the back because I've lobbied to have a PA representative also. But instead of allowing both, they created an either or kind of situation. So I just want to let you know that that's there. Now, going back to, I really don't know what to say about how this fee for service, I mean, if this just came from Ms. Blasey, then probably the advisory board has not seen it. So I will just stand to listen to what you want me to take back to the next meeting.
Any comments from the committee members? I guess I feel, yes? Did I hear a comment starting? Zoom noise. Okay. One thing I think we might consider, Carol, is to ask that APRNs be a designated position, that we would prefer that rather than an either or with the PAs and Board of Healing Arts, because we do represent different groups of individuals, certainly different professional perspectives. So I think that Bobby's concern is noted there, and I would like to see us at least recognize that in our communication back to her, stating that we've been an integral part of this since its inception. We certainly are paying for the privilege of participating, and that we would like a designated representation as part of that, especially when we're expected to pay a rather substantial amount in comparison to other groups.
Well, thank you. I would appreciate that kind of support. And what's kind of interesting to me when I suggested that a PA might want to be included in the board is that the physicians sitting around the table, who I respect greatly, by the way, they said, well, why do we need that? Because we represent them through the Board of Healing Arts. So, you know, it's just kind of been
Interesting.
an unusual conversation, but Carol, I really appreciate that wording. And if that can be captured and sent forward, because it sounds like we do have an opportunity to have some input. As far as that aggregate data sharing clause, I think what's happened with KTRACS is it's become a big data source. there's just so much that's possible that can be done from an epidemiologic perspective and an organizational management perspective, as long as it's aggregate data and there's no confidentiality or other ramifications. I don't think I would be concerned about that. I'm just not sure after September of 2022 what that fee for service would mean and who would be picking it up. I need to hear the explanation better for that.
Any other thoughts anyone has on the proposed legislation from the Board of Pharmacy? Well, thanks for everyone's consideration. And again, thanks, Bobby, for your participation and insight. And it's an important part of what this committee does. So we very much appreciate that. Moving on, Carol, any word about the nurse midwife regulations?
Nope, it's pretty quiet on the front about that, so I don't have any update there.
Well, makes our discussion short. Thank you. Has Amy joined us by call, perhaps? Amy Seipel is the CAPEN president, and they have informed us that they are going ahead with House Bill 2412. Last I heard, it was at the revisor's office, getting some language review, and was not quite ready to be brought forth to the committee yet, but they are pursuing legislation this session. Any other comments that you have, Carol?
No, I don't have any. I kind of assumed that Amy was going to come and talk, but I don't know.
The last communication I had with Amy was things were at the revisors and they weren't quite ready to discuss at this point, other than that they were proceeding with some minor clarifications over the bill from last year. So nothing particularly new to add at this point. So in March, I suspect we will have more information. New business. Last meeting, we talked about streamlining how we approve APRN programs. Out of state particular is what we're talking about, out of state programs, to avoid delays in APRN seeking Kansas licensure who may have been educated at a school we had not previously reviewed and accepted. If the board had just met, it could mean a delay of nearly 3 months. And that seemed very onerous and not fair to the applicants for us to be so delayed. So last meeting, we authorized the staff to go ahead and authorize licensure for APRNs, just like they do for RNs and PNs, as long as those schools meet our stated criteria, and then just report back to the board what has been done, and certainly raise any questions that might need attention. So, Carol, any comments or concerns in that new procedure?
No, I appreciate it. I know that the applicants appreciate being not having to wait, because that was kind of an issue. So on page 6 in your packet is the report that I prepared for the licensed applicants from out of state APRN's programs that have met the national accreditation standards and our standards that I have been approved to license since you met on September 15th. There's 5 of them. I just left it in this same format. We didn't really talk about how you wanted the information in a format. So I don't know if you continue to want it in this format, if you just want the schools listed. I'm not really sure. I just kind of continued this way.
Yeah.
But they all met the requirements. So it's kind of FYI for you, I guess.
So as far as you can tell, things are going smoothly and no concerns. And so it was each one of those schools one individual application,
Yes.
you think? Okay.
Yes.
Okay.
Yeah.
So that was probably an average month for us as far as numbers go. Yeah. Okay.
Just a comment on the format. I like the format. I mean, it's kind of nice to know what you've considered. It's not a big, complicated table.
It seems to meet our needs. I'm always interested in the variation of clinical hours.
Yeah, it's interesting.
Uh-huh. It ranges anywhere from the minimum of 500 to over 1,000. So that's a lot.
And I think that differentiates sometimes MSN and DNP programs,
It
which
very
we
well may.
otherwise wouldn't really have an idea of which was which. I don't know, just a FYI.
Yeah, the Education Committee looked at a major curriculum review for a school this morning that increased their NP education hours from 520 to memory's not serving,
Something.
over like 700. So it was quite a few hours they were able to increase by looking at the ratio. So they didn't increase the cost to the student, but were able to increase the hours that they presented. The faculty really felt like they needed to bump up the time because of the depth of information now required by all advanced practice nurses. So I'm hoping that we'll see that trend continue in other places, but that will be reviewed in the full board, but certainly wanted to bring that to the attention of our committee, that at least one of our state schools has recognized that they were a little short on clinical time and made the effort to do that and yet also protect the fees for their students, because it's not an inexpensive program by any means. So thank you, Carol. I'm glad that that is working, and any comments that you need, please let us know. Agenda for March 2021 meeting. I think we would like to have Amy Seipel on the agenda for any update she would be able to give us on House Bill 2412 at that point in time. We'll want to hear back on the prescription monitoring program and any further developments on the CNMI. And then any regulations or anything that we're up to do for reviews, Jill. I know you keep track of that for us. So if there's anything on that agenda. Anyone else have anything else? Well, I think we're going to have a short meeting today. We get by in 30 minutes. How about that? Remember this next time we're going for pushing it to get done in an hour's time. So may I entertain a motion for adjournment?
This is Ben. I motion to adjourn.
This is Dawn. I second.
All in favor say yes.
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 Any opposed say no. Are there any abstentions? Motion carries. Thank you, everyone, and have a wonderful holiday. Stay well and stay safe. We'll be thinking about you. Bye.